A lot of Marylanders are anxious, worried, and in many cases fearful that they and their families will either lose their health insurance or won't be able to afford the coverage they've had. You've heard many instances of that being the case. 190,000 of them will see their monthly health care premiums skyrocket by an average of 68%. That's in the small state of Maryland. Another 110,000 of them will see an average increase of 17%. Some 181,000 Marylanders are at risk of losing coverage altogether because of Republicans' manufactured health care crisis. Extending these tax credits is not an abstract issue for Marylanders. It will determine whether they have to ration their medication or face bankrupting costs. It will determine whether they can keep food on the table and a roof over their heads. Marylanders cannot afford to look away. Sadly, House Republicans are away. For the second week in a row, they are nowhere to be found. They could have worked with Democrats to protect the health of the American people. They could have worked with us to keep the government open. Instead, they are absent without leave. Although I suppose the Speaker would say he gave them leave. They left the American people on the tracks, and the train is now coming. The time to act is now. Premiums are at hand. The loss of coverage is fast approaching. The urgency for action is now. Not November, not December, not a CR to March 15th, as happened last year, but now. The only way to avert the healthcare catastrophe that is about to befall the American people is for Republicans to do what democracy demands: work across the aisle to create consensus. Instead, they turn their backs on consensus. The same person I quoted, Russell Vogt, was quoted just a few weeks ago that there ought to be less bipartisanship in the Congress. Let me repeat that. There ought to be less bipartisanship in the Congress. They heed the direction of Director Vogt to have less bipartisanship, not more. That is the exact opposite of what the American people ask all of us to do. Republicans continue to leave Americans waiting. Americans are still waiting on Republicans to lower cost, something Trump promised to do. Americans are still waiting for Republicans to make America healthy again. Rather, they abandon them on their health care. Americans are still waiting on Republicans to govern. Now, committee, I would like to call your attention to, because there's a lot of talk about who's responsible for this. Ronald Reagan was president when I came to the Congress of the United States. In the 8 years that he was president of the United States, there were some 8 shutdowns. One year he didn't have 7 he had. And I want to tell you how long they lasted. 1982, 1 day. 1983, 3 days. 1983, 3 days. 1984, 1 day. 1986, 1 day. 1987, 1 day. Why were they so brief? We controlled the House. The Democrats controlled the House. Ronald Reagan was president of the United States, and the Republicans controlled the United States Senate. It was because we all believed shutting down government was a stupid, harmful, and expensive policy for all America, not just federal employees, but all those whom they serve every day, answering phones on Social Security, helping veterans get their health care, doing the things that government does for our people. So it's shutting down America that we're really talking about. And the reason they lasted 3 days, which by the way was over a weekend, was because each of the parties, the Republican president, the Republican Senate, and the Democratic House, were willing to talk. We're willing to compromise. We're willing to bring this crisis to a quick close. How we all hope that we will learn that lesson from Ronald Reagan, from the Republican Senate, and the Democratic House for those 8 years. Come back, Republicans. America needs you. Thank you so much, Madam Chair.